A lot of people think that dementia results from witchcraft.
In our society, always we want to attribute a cause. So if there is no cause, we will not accept it.
The Quran category states that as a human nature, as we grow older, our state of mind starts to diminish.
You cannot take spiritualism out of these issues in Africa. If you take Ghana, for instance.
Caring for people with dementia is quite difficult, I must say. I am a caregiver, and I've noted that this thing, we take it spiritual. We are 3 brothers. My younger one is a pastor, and the eldest is a teacher. They are all having different ideology about what is making my father not remembering and other stuffs.
Maybe because of the stigma. The moment that they see a little sign of agitation or something about a patient, and the medical officer will say, this one is psychiatry.
As we sit right now, you need policy a year tailored towards dementia.
And so once again, you are welcome to the Cognitive and Diabetes Action Research Workshop. And as we informed all of us earlier, it's going to be about the disseminations of research findings, and we are also going to collaborate to create solutions to improve dementia and diabetes care in Ghana.
I am Precious Adade Duodu, a senior lecturer in adult nursing, an international lead for nursing, and also a co-chair for Black Staff Affinity Group at the University of Huddersfield, UK. And I am the principal investigator for both projects. The first project was focused on dementia care in Ghana. Specifically, we did a project here 2 years ago that focused on the prevalence and then the associated factors with respect to dementia care in Ghana.
It is purely focused on dementia, and so the most important thing is that we want to co-create some solutions with respect to dementia care here in Ghana. I think we have different stakeholders ranging from academics, researchers, we have clinicians, we also have patient, family caregivers, policymakers, faith leaders as well, and community leaders as well. So that's a real privilege to have all of you here, and based on that we will be able to co-create solutions for how we should take care of people with dementia going forward.
On behalf of the management of the university, being led by the Vice Chancellor, Professor Precious Adade, I would like to welcome you all to this program.
I'm also excited that we are talking about dementia. There are many times that people have been accused to be witches or so, when in fact they are expressing ill health and need support. It is important that we co-create solutions to this. They are the very things that are happening on the ground that we need to take a second look at.
It's very important that we know how many people have dementia in Kumasi, in Ghana, but we do not have the tools, we do not have the funding.
Do you have any plan of extending this important research to other regions?
But where it's just male, female, gender, did you actually go deeper to see a reason why women are getting it more? How can you curb it and all that?
When you spoke to the caregivers, what their level of understanding of the conditions were, did they know about it? How, even in their coping mechanisms, what they needed to do to stay afloat?
The moment somebody starts exhibiting this kind of signs and symptoms, either they will diagnose the person as high fever or attribute it to a spiritual cause.
A person who is consistently reading, acquiring knowledge, having some cognitive exercise of the brain are less likely and prone to some sicknesses and ailments, including all these matters.
Unfortunately, only few people are diagnosed with this condition. And as we have just discussed, we usually mislabel it and make it seem like it's something else. So we usually don't classify it properly as dementia. We call it all sort of names. But we are hoping that from now onwards, as especially healthcare professionals are doing their very best, we will be able to fight against the condition.
One of the most common thing between a man and man nana, education, which means that say investing more in higher education for both men and women. The risks of dementia and as a cognitive impairment and so better kakra.
One of the interventions, priority areas now, Precious Adade, is we need to develop caregiver training programs. And out of this, you bit me at church how to care for people living with dementia.
Usually they are more stressed. So one core thing we can do for them is to open some forums just to educate them about how they can distress. Because usually when they are stressed out, they are more likely to be frustrated and also pent out their negative emotions towards these dementia patients.
Have patients who are on medication that require that they remember to take, and the patient starts forgetting, and they are not screened at the NCD clinic for some of these things, the person will be worsening. To him or her, he or she is taking the medications fine, but the condition has started, and so there are memory gaps. So I think in the schools, if policymakers would listen to us, there should be a kind of retraining.
The home care is done by private clinics. We wish the government will also have a structure, but that's very, very far. I won't say far-fetched, but it's a long road. Even in the developed countries, most of these services are run privately as well.
Collaboration with the faith healers, collaboration with those who are taking care of them is very important, so that in these instances they have someone to talk to or rely with.
First of all, I would say that we're in the right directions in terms of having a research that is focusing on diabetes and that of the cognitive changes in the elderly. So all the conversation that is ongoing currently is about the aging population. We cannot take out the aging population itself, because that's where dementia actually falls in.
So if the clinicians are being organized and given a workshop on how to manage those cases before they even refer, because some of them, because of the stigma around, when they see the client, they just run away.
Speak against stigma or stigmatization of these conditions, and let's ensure that we build a better society.
The conversations have sparked a lot of great ideas, recommendations, and people are really excited that we've had these conversations, brought all the people who matter in the care of these conditions, and it has been great.
So my name is Joshua Otri, a PhD student at the University of Huddersfield, UK. We would have some plenary sessions. We would also break out into groups to discuss some of the issues based on our category of stakeholders here.
Because we want to know the importance or the effect or impact of this workshop, you may want to do a bit of survey to know what sort of knowledge you have, and at the end of the workshop you also want to take a post-survey to be able to assess if there's been a change in the knowledge and the experience.
The condition affects the cognitive ability of the patient, language is affected, behavior is affected, and society gives all different interpretations to this, which invariably adds to the stress and strain that the patient is suffering from. So education is also another way to go about it. It may not necessarily be formal education. Elsewhere, people get educated, get informed, not necessarily because they've been to school, but the system helps you to gain knowledge, and I think that is something that we should do.
As researchers, when you are able to come out with significant research findings that affect the lives of people, and you are able to share with stakeholders involved in this case, dementia, I think it's very, very important. There should be also the need for the state to come out with the laws and policies that will guide the care of the elderly, in which most of them will maybe having this condition, that is the dementia.
We've learned a lot about dementia, and being a mental health practitioner, I've seen numerous challenges concerning treating patients with dementia. And then this workshop has really been an eye-opener. It has helped me in shaping or making an agent of change, shaping the way I treat my people, and also the way I train students who come to my facility. We've learned that all dementia cases are not spiritually based, and that with science we've proved that there are a lot of medications that can be used in managing patients living with dementia.
Dementia hasn't been well known among parents when it comes to Ghana, okay, because we think that it's something that is spiritual. We have spiritualized everything. So this one is an eye-opening, bringing in caregivers at home, we the professional caregivers and all the stakeholders. So I think it's something that has to be pushed for policies, to be brought on board to, help people that are actually suffering from dementia.
So I have enjoyed this. I think this is one of the best events I've ever been part of throughout my life, because the information, the ideas we've shared together have been great. This doesn't end here, but we are going ahead. We are creating a network. We are going ahead to ensure that we support each other, amplify our voices, and ensure that policymakers are doing their bit, healthcare professionals are doing their bit, family members are doing their bit, patients are doing their bit, and everybody is doing their bit.
Thank you to Precious for being a very good Ghanaian, going abroad, studying there, looking at the issues in Ghana, coming back to do good for the country. Not a lot of people do that. So a big shout out to him, and we hope that he's able to do more so that we can all improve the situation in Ghana and improve our health.
So I want to thank the University of Huddersfield, where I work, for their great support with the seed funding for the Dementia Project 2 years ago, which resulted in the 3 peer-reviewed publications, which we disseminated on the first day and went ahead to do the workshop to co-create solutions with respect to dementia care. I thank the University of Huddersfield, specifically the School of Human and Health Sciences. I want to thank my head of department, Professor Warren Gillibrand, and of course Dr. Caroline Barker. I also thank all my bosses who've supported me in diverse ways. Professor Philip Brown, who obviously is our lead strategic lead when it comes to research, innovation, knowledge exchange, and who administers this funding. I thank the university leadership from the Vice Chancellor all the way to Provice and Dean, and then of course my Associate Dean, Professor Padam Simkada, Dr. Biba Simkada, and all other colleagues I work with, my line manager, everyone in fact, and the student I teach as well. Without them, I'm not sure that I'll have the environment to be able to carry out this research. So I thank everyone, family, friends, and everybody who've put their hands to this project and ensure that it comes to pass. Specifically for those who have helped execute this project, I want to thank Professor Veronica Millicent Jomeku. I want to thank the leadership of KNUS, including the provost of the College of Health Science, Professor Christian Ejare. I want to thank the research assistant on this project, Joshua Ochre, Dorothy Wilson, Abigail Doso. I want to thank all of them for working extremely hard, and all the healthcare facilities. I can't mention all the names, but they've been very receptive and been supportive. Even at the last minute, they were able to push to ensure that we had people even beyond what we expected. So I thank everybody who has been involved, and many blessings.